So I'll just give you a bit of background before we launch into my presentation, because I think, like Greg's, it'll be quite different to a lot of the 3D printing talks that we've had so far today. And I'll give you a little bit of background about myself and what music therapy is, and then how we're using virtual reality in that space. So I've worked as a music therapist in neurorehabilitation with people with spinal cord injury, brain injury, stroke, and also degenerative conditions such as dementia and Parkinson's. And I conducted a PhD looking at the effects of singing for people with high-level quadriplegia on their voice and their speech, which is sort of the inspiration for this virtual reality research that we're working on now. So a little bit of background about music therapy. This is the clinical and evidence-based use of music to accomplish individual goals in a therapeutic relationship. So it's quite different from using music to entertain people or teaching them how to play instruments because of that goal focus. And people of any age or any musical talent or lack of talent can participate in music therapy. I'm just going to play you a little bit of a clip because we had a participant interviewed who was trying out some of our virtual reality equipment, and I think some of his words sort of explain a little bit and sort of set the scene for what I'm going to explain to you. So when you've got a high-level spinal cord injury, breathing can actually be much more difficult, because in addition to affecting the muscles that you use to walk, it also affects the muscles that you use to help push out air, for example, when you need to cough or when you need to project your voice. A big breath in. Chorus.
I know I'm right.
Yeah.
Okay.
Ready? Big breath. And I know I'm right. We compared groups of people with quadriplegia who sang together with a music therapist versus people who came together in groups and did other music-related activities. And we found that there was a significant improvement in their ability to project their voice.
I think for someone in my position who is going to spend a lot of time in a wheelchair, it is difficult sometimes to move around. Using the virtual reality, it makes you not think about your injury. If I had 5 people around me, I'd probably shy away from singing. But using that apparatus that we use, virtual reality, don't have any reservations in singing, because it's like no one's watching you. That's why I tell you, you better be home soon.
So I might just go back a step now and just explain why we're using virtual reality and why we're actually even using singing with this group of people. So as well as losing the function of your arms and legs after a spinal injury, people with quadriplegia also lose the control of the muscles that they use, that we normally use for breathing and high effort breathing, so our chest and stomach muscles. And so that means that respiratory dysfunction is quite a problem for this population. It can lead to pneumonia and upper respiratory tract infections. They can't cough properly, and they also can't project their voices well and run out of air when breathing. And we hypothesised that singing could be used as an alternate form of training the respiratory muscles, the accessory respiratory muscles that people still have access to after quadriplegia, so the muscles in their neck and chest. And we wanted to look at that because we know that respiratory exercises can be beneficial for this population, so they can improve their respiratory function, but it's something that needs to be practiced every day. And when you stop practicing or breathing into these respiratory training devices, then the effect goes away. So the idea was, if we could show an effect from singing, that would be something that people would incorporate into their lifestyle, and it could be an ongoing benefit. The problem was in our study that we had difficulty getting people to come into the hospital for these face-to-face groups. So a lot of people with quadriplegia live in rural and remote areas, and we found it difficult to recruit a large enough number for our trial, and also just in general getting people to come back in for groups like this. So we thought if we could find a way to bring this type of intervention, this group singing thing, to people in their homes, that would overcome that problem. And the first idea really was to look at a Skype-type teleconference way of delivering this program. but the main problem was that there was difficulties with latency. So I don't know if you've tried to sing in time with anyone, sing happy birthday to someone over Skype, but it doesn't really work because of the timing lag between different computers and internet speeds and things like that. So that was the first obstacle that we had to try and deal with. But so I went to the Melbourne Network Society Institute at Melbourne Uni, and we got a seed grant to try and solve some of these issues. And that's when we thought, well, maybe virtual reality might be an even more immersive experience than just sort of looking at someone on a computer screen. So that's the funding grant that we had. So we've now got to the stage where we've been testing this in a clinical setting, so trying out different types of headsets, some of the ones that Greg mentioned, to see how people with altered sense of perception after a high-level spinal injury go. How can they tolerate wearing the mask on their face? How does that affect their sensation? Does it cause nausea? All those kinds of things. And we have also been able to develop a way around this latency issue too by using a wired network, so a separate audio to the video or the VR. So we're putting those two things together at the minute and getting sort of an in-time sounding a time lag. So it's about 20 milliseconds. So to the ear, it sounds pretty much in time. So I'm going to play, I think, a clip now that shows you the time lag. Just have a nice gentle hum. So nice big breath in again. Fill up your lungs with air and just pick any note that's comfortable, just gentle warm up. So big breath in. The next thing I want to say was that we, to get around the time lag, we can also do singing type activities that don't involve timing. So singing drone type activities and just doing long sounds, which also have a therapeutic aim of extending the phonation length and things like that. So that's sort of what this sounds like. One more chorus. Knock, knock, knocking on heaven's door. And knock, knock, knocking on heaven's door. Knock, knock, knocking on heaven's door. And knock, knock, knocking on heaven's door. So you can see in those clips some of the different spaces that we can do our group sessions in, space or around the campfire, and lots of different options. So our participants really found the virtual reality experience something that was positive. We had no negative reports at all about sensation or nausea or anything like that. And this is a great quote. When I was in VR, I wasn't thinking about pain or anything like that. I wasn't focusing or concentrating on my disability. In sitting in a chair, it was more like, wow, I'm sitting on a rock in front of a campfire.
Oh, look at this. There's the earth. You feel like getting off the chair and walking around.
Are you in space?
I am. This is cool. There's a planet there. Well, that's Earth, because I can see, I can't remember, it's like Russia. And there's a planet there, I presume that's not Earth. Wow, awesome. Ah, look at that. You wouldn't want to be afraid of heights. Return to reality. That was cool. That was so awesome.
Yeah.
That was so awesome.
Yeah, it's been a whole group project really. So at the stage we are now, we've been working on, when I say we, I mean they have been working on developing a new virtual reality application that's specifically targeted to this project. So the clips that you saw there were in VTime, which is a sort of an off-the-shelf VR application. But we're using a similar idea, so building a couple of different spaces that people can go into, so the campfire, but we're building into that the opportunity to scroll the lyrics up on the screen, up on the sky above the campfire or wherever, with the guitar chords and things like that, so that we can make this just a one-stop shop kind of thing. So, and we're still working on building our wired audio and connecting those two things together. So it's still a work in progress. We're about to do some more testing next month back at Royal Talbot with some more spinal participants with our newly developed app. And then the idea, I suppose, down the track would be, once we've got this this prototype developed, that we try and use it in a clinical trial. That's where we're at. So thanks.